So biologics have been almost a game changer, especially for those who suffer from severe asthma, because a lot of these patients, unfortunately, are reliant on oral or injectable steroids throughout the year, and especially for pediatric patients, steroids come with a lot of side effects. So the nice thing about these biologics is that it helps us minimize the use of steroids and control their asthma better, along with actually other comorbid allergic illnesses. So not only are we getting the asthma under control, but for many of these patients, we're also getting their eczema under control, or their hives or other things. So it's kind of nice, we can address multiple issues. And it's also nice that we can control their asthma better and reduce their need for steroids. So it's very patient dependent, just like everything else. Before we really only had omalizumab or Xolair, but now we have other options, which is nice because one person may react beautifully with the Xolair and are very well under control, whereas another patient it may not work as well for. And then also the comorbid conditions play a role. So there's certain medicines like dupilumab which help if they have asthma and eczema, whereas omalizumab works for asthma and hives, and possibly we're seeing less reactivity in those food allergic patients too. So it's very nice that now we can kind of tailor it child to child, whereas before we didn't have that option. Yes, absolutely. So, just like any other medication, if it's not working well and they're still having asthma attacks or flare-ups, then absolutely we do switch. We usually give each biologic 3 to 6 months to take effect because it's not meant to work acutely. It's meant to be an add-on controller medicine in addition to already all the inhalers and other medicines they're taking. So we do have to give it some time, but we do switch if it's not working. And especially some of the patients who had been on omalizumab, the ones doing great, we don't switch those, but if they hadn't been doing great, now that new options are available, we do consider, because maybe one may work better for them. So the expectations, at least from the physician standpoint, is that we should be doing a better job controlling it now that we have so many more options. Unfortunately, 10 people still die every day in this country from asthma, and that shouldn't happen at all because with all of the advances we have and medications we have. So at least from the physician standpoint, the expectations are high for controlling asthma. I'm hoping now, as patients have more access to internet and TV and all of these things, that their expectations are also high for controlling it. So there's a big education component that they should also be, if their asthma is not controlled, they should be proactive about asking their physician why and if there's other options too.